All right. Dr. Sreekala, we are about to start.
Okay.
All right.
Okay. Yeah.
Thank you so much. So, as I had mentioned, this talk is going to be recorded. That's why we
Okay.
have spotlighted our speaker and our two interpreters. Um, so good evening and good morning, everyone. We have some folks here in India attending, as well as folks in the US also attending. My name is Jerry Rosario, Geri, and my sign name is, I point to my eyeglasses and I do the letter G sign, ISL sign for G, which is like one fist above of the other. All right. So welcome everybody to this USH India meeting. And USH India is the India chapter of the Usher Syndrome Coalition. Okay, and one of the things we focus on with the coalition is to connect researchers and individuals, researchers with individuals, and also other resources that we have in India as well as abroad pertaining to Usher syndrome. So as part of this goal, we wanted to invite somebody from Sreedhareeyam, who Sreedhareeyam is providing treatment to folks with Usher syndrome, especially retinitis pigmentosa. Right now, we have 4 members of the Usher Syndrome Coalition who are patients of Sreedhareeyam. My son is one of those members. Another member is the son of Lata Varma, whose son has been going to Sreedhareeyam for, I think, at least 15 years. My son has been going to Sreedhareeyam for 2 years. All right. Before I continue, can I please request Ravindir? I thought you are the main signer. If you can please start signing. Okay, so it will be recorded. Okay, great. So our speaker for today is Dr. Sreekala. And I received her profile and it's like very long. She is such an accomplished doctor. She has about 24 years of experience, at least 24 years of experience in Sreedhareeyam in terms of clinical experience. Now, Dr. Sreekala wears a lot of hats in Sreedhareeyam. And what caught my attention is her involvement in the research arm of Sreedhareeyam. She's directly involved in a lot of research activities, including observational studies as well as interventional studies. And by the way, interventional studies are what we sometimes call clinical studies or clinical trials. Okay, involved in these studies to analyze the effect of Ayurvedic therapies and medicines. She's also active in product development as well as the publication of research results in peer-reviewed journals. Now, I specifically mentioned peer-reviewed journals because there's a lot of interest in seeing peer-reviewed research around retinitis pigmentosa as well as Usher syndrome, peer-reviewed research, published research, not just of one patient, but many patients with a control group and so on. There's a lot of interest there, especially for those who do not believe in Ayurvedic treatment. So anyway, that is my brief introduction for Dr. Sreekala. This is going to be a Q&A type of a talk. So hopefully this will be more interactive for our audience. Feel free to ask questions. Okay, so my first question for Dr. Sreekala is that if you could please elaborate a little bit about your background. You are, I believe, third or fourth generation in the Nambutiri family in this line of work. If you could please elaborate a little bit about your background, as well as the history of Sreedhareeyam in terms of treating eye conditions. Thank you.
Thank you, Jerry. Good morning and good evening to all. I'm very happy to be here in front of you and very happy to see all of you attending
Um,
this condition. Can you hear
excuse
me?
excuse me, doctor. I can hear some background noise. Is everybody else hearing that?
Yes, I'm
Yes.
hearing it too, Jerry.
All right. Just a minute, okay? Let me make sure that everybody is muted. If everybody else is muted, that would be great.
Still you are hearing?
Okay, sorry. If you could please continue. I'll try to figure out that background sound.
Sure, sure. Okay. Thank you. So regarding your first question is regarding Sreedhareeyam, no? Sreedhareeyam is a renowned Ayurvedic institution. It's usually it has a history of around 400 years because founded in 1820. But this is from our ancestors, and but for my knowledge, that institution, that clinical practice, and that product medicinal development, everything started in 1931 by Vaidya Trivikraman Nambudri, my grandfather's great grandfather. He has started that, and along with his brother, Vaidya Parameshwaran Nambudri, and he was more interested in that manufacturing of medicines, Ayurvedic medicine, herbal formulations, separate formulations for each diseases. They have started as a small clinic in that usually they used to visit the patients at their home, and they will attend the patient's conditions will be analyzed, and then medicines will be prescribed. Like that it was following. He was a great scholar of Sanskrit, even Sanskrit, because I don't know whether you know that, but the most of the Ayurvedic literature is in Sanskrit. So that Sanskrit learning, it's an important thing. So he was a great Sanskrit scholar. He used to teach the Sanskrit also. So they were practicing that, and that was going on well. And but from that other things, that Sreedhareeyam as an institution started in 1999, because that is my father, Dr. NBP, late Dr. NBP Nambudiri. He and his brother Mr. Narayanan Nambudiri, that chairman, the present chairman of Sreedhareeyam. They have started this institution in a small uh, setup. Small setup means 10-bedded hospital, like it has started. Because that time, from the beginning itself, we were there in that institutions, because my father was in the government services, so he was with the other research activities there also. So we were looking after this institution, and it's after his retirement he joined fully to this institution. So slowly that from the beginning itself we were seeing that patients with this retinitis, Usher syndrome and retinitis pigmentosa, like patients we were seeing. And because of this progression nature of the diseases, we were interested, because at least they should have maintained that vision, no, their lifetime. If it's not curable also, they should maintain that vision till the death, or at least they should have some confidence in other activities also. So we were so like that we were preparing some medicinal and treatment modalities also prepared. So that it's because that history Sreedhareeyam has remained committed to the that preserving traditional Ayurvedic knowledge, because that we have that other means in investigations from that modern side also, and that but the treatment aspect everything with that Ayurvedic no Ayurvedic tradition only. Ayurvedic, that's only herbal formulations, and that formulations according to that the ancient textbooks, and some changes in that only we were given, because it's that preparations and combinations everything depend on the ancient Ayurvedic text. So today that institution is having a 400 bedded hospital. So we have different branches in around 23 branches in Kerala and outside Kerala, means all over India. So that their inpatient facilities are also there and outpatient facilities are also there. And other than this eye conditions, we are offering the other departments also, general conditions also, general treatments are also there, and pediatric means then means orthopedic departments are there, and women health that is there, design that rejuvenation therapies like that is there, age related thing, degenerative conditions, old age therapies like that, it's that is other departments are also functioning other than these eye conditions. So we have some now experienced practitioners, uh, great experienced practitioners. Other than that, family members are also around 9 doctors or 9 to 10 doctors are there, and other than that, any other experienced practitioners are also working here in research department and in the factory, and other this clinical setup also. We have a our hospital is an accredited NABH accredited hospital, and we have an manufacturing unit also, NABL accredited manufacturing unit. So the medicines are prepared there only, and the good lab facilities are also there just to analyze that the quality of that medicine. Okay.
All right. Thank you, doctor. This is Jerry. Um, we have a few people in the audience who may not be familiar about Ayurvedic treatment. So
Mm.
in layman's term, can you tell us about, what is included in Ayurvedic treatment? Is it simply herbal medicine, oil massage, and so on?
It's not like herbal medicine and oil massage and all, because Ayurveda, the main aim of Ayurveda, it's swasthasya swasthya rakshanam ayadirasya vikara prashmanam. That is the just I'm just quoting a slogan. That's all. Just maintaining the health of a healthy person and treating the diseases. Okay, that so main aim is to maintain the health of a healthy person. So like that, for that it has a different branches of Ayurveda also. Eight branches are there. Ashta 8 branches of Ayurveda in treating different conditions or different areas of that our of body. So in that, it's eye conditions. It's coming under that urthva roga, urthvanga chikalsa, means diseases above the neck, eyes, ears, uh, nose, and head, everything included under that. So that specialization it's there in 8 branches are there. So the after completing that BAMS in the graduation, the specialization in each section it's there in that other doctors will specialize in the other departments also. So then they will start it. So we can't say that this is just a oil massage and herbal medicines, because I don't know whether you have heard about Panchakarma therapies, because Indians will be knowing that. Panchakarma therapies means five types of purificatory therapies. It's not like this massage and kiri or anything. That is all. It's a preliminary things of that this purva karma. This, because before that starting that main uh, therapy, it's that panchakarma. So before that starting that panchakarma, some preparatory things are there, this massage and all, uh, because all the things are, it's not like for massages and will help for that. So that main purificatory therapist that uh, aims to eliminate that doshas, because ayurveda depends on that, ayurveda principle depends on the three doshas, vata, pitta and kabha. Three doshas are there. So that three doshas, we are treating that sharira, the sharira, that all the body, it's considered as a panjabhuta, that five elements like earth, water, this fire, uh, air, everything. That panchabahabhutas, space, everything. So all the three doshas are derived from this Panchabaha Bhudas only. This five elements also. So the concept is that just to, because all the doshas, because the whatever that disease is also, the that balance of these doshas are the health, and any imbalance in these doshas will considered as disease in all the parts of the body. Everywhere this balance and imbalance will be there. So that depends on the lifestyle or the genetic problem, whether it is a genetic or any acquired things or the, because the disease, we classify the diseases into seven types, that is genetic diseases, and then congenital, humoral, then some traumatic, ecological and supernatural or natural, other diseases also we consider these diseases are. So uh, that genetic means Usher syndrome and all, it's a genetic disease, it's a genetic entity, it's there, no? So we consider this, that this genetic, this is that genetic part is also described in that ancient text. That time itself it is all described there. Because of that, along with that, uh, what is the union of this semen and that uh, ovum and semen, that all, that health of that semen and ovum also, that all uh, depends on that the genetic factors also. So we, the inherit, because that we have inherited characteristic between the parents and offsprings are facilitated by this units or this important aspect. This there are enumerate by nature due to innumerable organs and structures. Because of that this unhealthy ovum and sperm, the diseases can occur. So that genetics is described accordingly. The main thing that the treatment aims to maintain that quality of that health quality of health, and also that because uh, some therapies like shodhana, some purificatory therapies will be there. Then brahmanam, improving that general conditions also, it's there. Then rasayana, rejuvenative therapies are also there. So in genetic disease disorders like this Usher syndrome and all, this rasayana therapies will have that great role, because that will help the to maintain that uh, conditions, or to stabilize the condition. Because it's not, we can't say that it's curable, but that can help to improve that quality of, or improve the quality of means vision wise, it's improve the quality. And some different types of rasayana, these rejuvenations are explored there. It's a preventive and therapeutic mode of management. So that restores, rejuvenates the seven functional, the tissues, rejuvenates the tissues, the tissues. So the treatments includes some preparatory things and then purificatory things and then that rasayana therapies. Rasayana means that rejuvenatory things. That is all needed. Just with some medicines, internal medicines, and just it will not have that effect. Okay.
All right. Thank you, doctor. I hope we haven't lost the others in terms of some of the terms that you had mentioned.
Mm.
But I'm glad that you are also explaining some of these terms because we have some non-Indian attendees as well.
Yeah, yeah, I know.
Yes. When I was when my son and I were at Sreedhareeyam in Kerala, one of the
Mm.
things that Dr. Narayan told us was
Mm.
why we go through all of this treatment and why in between visits to Kerala that continued use of the medicines is also important. He mentioned that it increases the blood flow. A lot of these medicines increase the blood flow around the eyes and around the ears, and to keep the cells healthy. See, part of my understanding is part of retinitis pigmentosa is some of the cells in the eyes are slowly deteriorating. That's why the peripheral vision is slowly going to deteriorate as well. So when he
Mm.
explained to me the need to increase that blood flow around the eyes, so the eye cells continue to receive nutrients. For me, that kind of logic clicked in me, because it's in a similar way as we are taking vitamins, we are taking healthy vegetables, we're trying to keep the cells of our body healthy. And part of the things that they had prescribed for my son is certain type of diet, certain type of foods that we have to avoid, and also certain types of lifestyle things, like for example protecting the eyes from the sun and so on. So for me, the logic sort of made sense, because we have tried other medicines as well, you know, and I didn't understand, okay, why would this work, and so on.
No, that thing is that all the things, because that whatever that you told, no, that some nutrients like vitamin supplements and all. So like that, this rasayana will work, because rasayana means that rejuvenative medicine. It's like a combination of medicine or some therapies which have some nutrient effect. Okay, but for accepting that nutrients, for absorbing that nutrients, we have to prepare that our body, no, we have to prepare our body, because because if our body it's not that prepared for that, for accepting that, before that, for that only this preparatory therapies like panchakarma and other things, body treatments and some other therapies are there, no. Then then the last thing is that rasayana to maintain, or in Usher's syndrome, other genetic disorders, it's not curable, no. So curable. What is the main aim? Is to maintain that condition. So in other diseases, this rasayana, in other diseases also this rasayana therapies, this that is there, that rejuvenation, the nutrients. So that is like nutrients, giving nutrients. Okay. So that is to eliminate or just to uh, fully uh, curing that other condition, other some diseases, this type of nutrients will help. Okay, for before this applying these nutrients, this therapy is also this means purificatory therapy is also there. So that includes that body purification and some some eye treatments. So you'll be seeing that, no, some eye therapies also will be there. Okay, just to improve the circulation, uh, and along with that, this uh, diet also important, diet, because that is, because we are all in Ayurvedic concept, that main thing is that our stomach means our digestion, whatever we have, the digestion should be proper, then only that the health will be maintaining. So that should be maintained, and uh, that proper medicines and proper time. So then the exercises on, then stress relief things is like, so like that the yoga also will help. Okay, to some extent yoga will help, because it's direct impact, it's not there also. It can improve that circulations, improve that mental power, improve that confidence of that level. Okay.
Okay, this is Jerry. Thank you, doctor. I also wanted to share with the others sort of the experience of my son. So when we first, so this year is the second year that my son has gone to Kerala, to Sreedhareeyam. And for each visit, we were advised to be there for 14 days. Okay. And the initial things that were done were, you know, do all of this diagnostic eye test, the OCT test, I think fundus photography, the visual field test, and all of these were designed to have that benchmark, and then the second time we were there, these tests were repeated. So there is data maintained. Just a minute. Okay, so there is data maintained to see what is the progression of the vision. Okay, let me actually just a minute. Let me spotlight Sonal now. And remove the spotlight. Okay, so now we have Diane for ASL and Sonal for ISL. All right. So what was I saying? So anyway, based on our experience there for the treatment of retinitis pigmentosa, um, so there's a lot of different varieties of treatments that my son had to go through, and I'm going to explain things in more layman's term. I'm not going to use the actual name of the treatment, because frankly I had forgotten. So one treatment, just to describe to the others, one treatment was there's like a paste that was placed, herbal paste that was placed on top of the head um, um, for a while, for around 30 minutes. Another treatment was uh, some sort of oil, herbal oil massage on the eyes. Uh, Another treatment was herbal oil massage around the ears, because again, this is for Usher syndrome. Both eyes and ears are part of the treatment. And then the other, there's a variety of treatments. The other treatment was there's like an like, I don't know if it was ghee medicine or I can't remember the name of the oil. It was poured around the eyes for around 30 minutes, covered, the eyes were covered for a while. And there was like a dough placed around, and then after that, some anti-inflammatory petals were placed on the eye for a while. And I know I'm not doing justice to the explanation of all of these treatments, but I have to say my son loved the treatment. My son is 12 years old. He was not at all disturbed by all of these treatments. He actually loved it, and he was very, very much relaxed by it. And the other thing was that also the atmosphere in Sreedhareeyam, if you're actually there in the hospital as opposed to just visiting, you know, a day patient, you get to meet a lot of patients with so many different types of eye conditions. There is diabetes that causes the blindness. There is retina detachment, people who go there for cataracts. There is actually a Hindu priest who has been going there after he had his eye operation. I think it was for cataract or something else. He kept on going every year to Sreedhareeyam because he knew that with the eye operation, the cells and muscles around his eyes have weakened. And he kept on going there every year to ensure that whatever is the health of his eyes will continue, will be maintained to be healthy. You also get to meet other people who have had success stories. That there was one guy, now I can't remember anymore what was the condition of his eyes. He suddenly became blind. And through 3 visits to Sreedhareeyam, he was able to regain his eyesight. I I was not I did not talk to him directly, so I didn't know what was his condition. I had met a lot of people there with retinitis pigmentosa, a few patients with Usher syndrome. There was even one patient with Usher syndrome who was specifically recommended to go there by his regular eye doctor, to specifically go there. So the atmosphere there, to hear that Ayurvedic treatment has actually helped some of these different eye conditions, and people going back and their eyesight slowly improving or being maintained, was for me as a parent of a young boy, was very encouraging. I also like the fact that there was no surgery involved and no genetic thing, you know, right now, unless there's something proven with genetic therapy. I'm a little bit hesitant for that. So I wanted to share that experience also. Now, I want to ask the audience right now if you have questions for Dr. Sreekala. I would open the floor for others to ask. Okay, I don't see. Did somebody? Oh, all right. So nobody has a question right now. So I would like to continue. Doctor, one of the things that, as I mentioned at the start, people would like to see if there are any published research on the effectiveness of the Ayurvedic treatment for maintaining the health of retinitis pigmentosa. And I had seen in the research website of Sreedhareeyam that there is one paper, I think it was published in 2023, a case study for one patient with retinitis pigmentosa, and the the test results for the first visit and the test results for the second visit, and it was a published research. I also noticed that there was another paper, another research done, although I could not see the paper. It's entitled Retinitis Pigmentosa Ayurvedic Regimen, a comprehensive protocol tested on 50 participants. I didn't see any papers. I was wondering how we can have access to that study, especially since it is for 50 participants. We are very interested to know how these 50 participants reacted or to the treatment.
Okay. So no, that we have that in retinitis pigmentosa, that published papers are not that much. Published papers are not that much, but we are on that research because we are collecting that data of previous years now, previous years, that we are that collecting that, and we are making it, and just to, because it one case if you publish like that also, it will not be that much engaging. We have to collect many cases now. So we are collecting, our research department is doing that work also. And we are very good, very happy newses are also there, because in, because 15 to 20 years patients are also, they are maintaining, they are visiting, and they are means still they are communicating with us, and they are maintaining, they are doing their work, they are active in their work. That is because very we were very hopeful in that, because after hearing that, after, because they are visiting, means visiting means not like every year the treatments like that, not like that, but occasionally once in 4 years or 5 years also there. But in some cases the deterioration is also there, deterioration is there, but that is a slow deterioration is also there. Okay, we can't say that every case it's like that, some slow deterioration. So the data we are collecting, so we will be publishing, because for publications anyway we need that much this one, no? Because otherwise it will not be that that it will not be good. So the other single cases are many, but in we have that this year I'll give you that. This year, the total number of RP patients from 1st January to this 30th June, this 24, that is 172 patients were there, and that in that new admissions were 24 new admissions, follow-up patient one, but other 148 for patients were follow-up patients. So total ushers in patients admitted in January to June, it's 16. So in that, that many patients are like IP, that 3 to 4 times IPs, or some one time IP, like that also it's there. And year means 15 years, 12 years, 13 years, that much year they are following, because they're following up. That age also, it like above 50 patients are also above, the age is like above 50. uh, they're also visiting. So that is a good thing, this positive thing. And at least they are maintaining that what we are experiencing, it's a, we can't say that it that the other, because if you take that fundus photo and then field test and everything, any drastic improvement in that we are not expecting that. But only that main thing is that confidence level it's more, because that adaptation from bright to dark, when they enter into a dark room, no, the time taken for that adaptation, it's improving. And at least they are confident in moving, because we have been college going students and all, they are all, because we are giving like that advice only, maximum to uh, be uh, uh, self depend, don't depend on others, self dependent. So they should have some confidence, no. And to maintain that healthy lifestyle, that is a very important thing. Because this can because if it's associated already, it's a genetic disease, if it's associated with other lifestyle disorders, then it will be difficult now, the other things and the complications and all. So healthy lifestyle should be maintained. And follow up some treatments also, it's good that we can't say that every year it should be done, because it's not possible for everyone to do it continuously for that long time, no. So but some hopeful results are also there in that, in our collection data. Okay.
Thank you, doctor. I'm going to read some questions that are posted in the chat. One question from Dr. Namita Jacob. from a deafblind adult who is not able to attend the meeting. What is the science behind the approach to treatment of RP? Does it focus on building the health of the retina? How is it different from treatment of other eye conditions? So this is a question in the chat.
Yeah, yeah. That main thing I told you, as I told you, that Ayurvedic, the treatment approach is slightly different than allopathic, because we are not just treating that eye conditions only, because this is it's a genetic conditions anyway. We have to treat that body itself, that sharira, that body full. We have to consider what the nature of that body, how is the, how other conditions, everything we have to so like that we will plan that some therapy, some rejuvenative, purificatory or regenerative therapies also, along with some eye treatments also will be there, that can improve that overall circulations of that retinal circulations also can improve. We can't say that that pigments everything will be is all that structural changes will happen in that. We don't expect that also, only that functional things will improve that
Doctor,
way
if
it
I
will
can
help.
just clarify, I just clarify the question?
Yeah,
This is Namita.
yeah.
I think what he was asking is in Ayurveda itself, is the treatment for RP different from the treatment for other retinal conditions? Is there?
Yes, it's different only, because we are, I told you, because that it's not like same as some inflammatory conditions. Okay,
Right.
it's a degenerative conditions and inflammatory, this is a different things. So that entire medicines and therapies, everything will change. Okay.
Yeah, that makes sense. Thank you.
Okay.
Thank you. On to the next question. We have Lata Varma, whose son has gone to Sreedhareeyam for at least 15 years. Aruna Goel would like to hear her experience, Lata's experience with Sreedhareeyam. Lata, will you be able to talk? I think you are muted.
Hello, can you hear me now?
Yes.
Oh, okay. Actually, it was not 15 years. We went from 2002. So it's almost 20 years, more than 20 years. His, actually, the thing is that his deterioration has been was controlled to a great extent, that he could lead an almost normal life till some 4 years back. It was about 4 years back that his condition was a little more bad. And Sreekala was the doctor. And actually, Arun is very happy with that. And he keeps asking me when we are going back for one more treatment. So the deterioration was in 2002 when we went there, he had very little vision. But over the course of this year, he has been able to maintain a almost normal life. And he was even running his own business for photo. That was entirely due to Sreedhareeyam treatment. There's absolutely no doubt about that. Because all the allopathic doctors were saying that there was no, he would be completely blind and you had to teach him braille. But see, from Sreedhareeyam's treatment, he was able to maintain a normal life till 4 years back. That's sure.
I have another question, Jerry. Is that okay?
Okay,
Yes,
sure.
please go.
Dr. Sreekala, what type of what documents or any past histories would you need if we were to come and visit? We would be coming from the US. So what kind of paperwork would you need for us to bring if we were to bring our daughter?
No, you can send that details of your that condition, na?
Okay, she has a very special one. It's not just Usher syndrome. It's HARS 3B.
Okay.
So I'm wondering if you would need like genetic testing, all of that done. Like we have all of that paperwork.
Anything because previous any reports are there, then you can send it. Then we'll
Okay.
see. Okay. And that present condition and how is she and now
Okay. And then like the initial visit, how long does that normally take?
the treatment you are asking.
Yeah, the initial treatment.
uh, Treatments and depends on that condition. It's 2 to 3 weeks, sometimes 4 weeks, that inpatient treatments, but depends on that conditions we'll plan. Usually 3 weeks initially.
Okay. I'm just trying to get an idea so that when we come, we have enough time to,
Yeah.
prepare for it.
Yes. That other detail, if you can send that mail also, no problem, that you can send the report. After seeing that, we can plan something, and then we'll inform you how long and how it works, like that, after
One
seeing.
more question. It's not related to Usher syndrome at all. Do you also have a treatment for cancer?
uh, we are giving medicine, but just we are supporting with the other system of medicine, no? Supporting that, we are doing that treatments, but along with the allopathic therapies.
Okay. Thank you.
So this is Jerry. I remember for our initial visit, before we actually scheduled our first visit, we had an online consultation with a doctor at Sreedhareeyam, where we had sent to them whatever reports we currently have. For example, the most current audiometry test, the most current visual field test, and so on. So, and then we had that initial consultation, online consultation. And from there, they had suggested to us how many weeks or days we need to be there. So hopefully that will help. I will share with the group the contact information to make that initial online consultation. Okay. I'll move
Thank you,
on.
Jerry.
All right. I'll move on to the next question. This is from Adrian. I hope I'm saying the name properly. It sounds like the treatment for RP and ushers involves mostly direct contact with the eye and ear areas through oil and Abhyanga type massage. Is Panchakarma also part of the 2-week treatment, or is it a separate recommendation for better circulation, absorption of nutrients, and whole body health? I ask my question because I know of a Panchakarma clinic nearby in the US, but I'm pretty sure they don't include eye treatment. But if Panchakarma can have at least a supportive role in treatment, that would be a helpful place for me to start before making the decision to come across all the way to India.
Because that treatments depends on that panchakarma, which panchakarma, it's that depends on that condition of that patient. Okay, after assessing that, only that we have to tell whether that panchakarma is needed. In some patients, that panchakarma, all that therapies will not be needed, but some because mostly that in RP and Ushers, without any other complications, that normal panchakarma therapies also will be included along with this. Okay, we'll plan according to that condition. Some of them, like Yeah.
All right, this is Jerry. Adrian, I hope that answered your question. Otherwise, if you can unmute yourself and you can ask further
Yeah,
details.
so that is helpful. It sounds like so I have Usher type 2A, and it sounds like from the answer I just heard, it depends on the severity, like what symptoms I have, how far it progressed, and it's kind of on an individual basis. Is that correct?
So Panchakarma, it's in that treatment wise and also improving that for general means to maintaining the health also. This is recommended. Okay.
Okay, just a minute. Okay, I'm trying to switch the ISL interpreters. Okay, I think I've got it right. Okay, so I'll move on to the next question. This question is from Lata. My son is 5 years old and has Usher type 2C. At what age can we start treatment at Sreedhareeyam so that he can cooperate with the treatment? So 5 years old.
Even 5 years we are treating because that all the therapies will not be there. Accordingly, we can start some medicines also, no, and some therapies, some minor therapies, and some there will not be some panchakarmas and all, but eye treatments will be there, and some internal medications also can help in this age also.
Okay. So if we need to stay in Sreedhareeyam, how long it will be for him?
That after sometimes after seeing the reports and all, we'll see that how severe now, how is that condition now. That inpatient is also we are doing in 5 year old if the child is cooperating.
Okay. Thank you.
So this is Jerry. Just to inform everyone, the for inpatients in Sreedhareeyam, they have a wide variety of accommodations. And for me, this actually suits depending on how much people can afford the treatment. They have wards where people actually share a big room and just have a bed in there for themselves. And then the treatment cost would also be lower. So, and then from there are wards, and then the next level, I believe, is a standard room with no AC. It has two beds, so it has room for the patient as well as a caregiver. And then they have standard room with AC. Again, two beds, but with AC. And then the next level is a suite room that has a separate sort of living room and a bedroom. That one has AC. That one also has a small balcony. Okay, and then there are villas also, and they have a separate what they call, I think, Ayurvedic village, which has more facilities, and which usually a lot of the foreigners stay there. They have better facilities in there. Of course, the treatment costs will also be higher. So there is a wide range of accommodation to suit the person's financial capacity. I know of people, I've met people who actually traveled from Mumbai to Kerala by train. And then from the train station, they took a bus to Sreedhareeyam and they stayed in a ward. So the cost of that is much, much lower versus if you go there by airplane. And then from the airport, there is a 2 hour taxi ride going to Sreedhareeyam. Okay, and then you can stay in whatever type of accommodation you can afford. So they have inside the facility, they have their own food court. By the way, it's all vegetarian food. I know some people who have gone there were complaining a little bit because they wanted non-veg. Okay, so they have that. They have laundry facility. And then the other thing you have to remember when you actually go there, uh, especially for the patients, you have to protect your eyes. You cannot be moving around in the sunlight. So most of the time you will be asked to stay in your room. Preferably no devices because that will tire your eyes. Okay, nothing intensive eye work. So initially people will have that sort of withdrawal with this other, a different kind of what do you call it, situation where you have to stay in. You cannot use your mobile as much because that will tire your eyes and so on. But then think about it as unplugging, that if you have a family member with you, it's time for you to bond and think of other things you can do. After 5 p.m., people go out when the sun is down. You see a lot of the patients outside mingling with each other, going for short walks around the complex. It's very, very relaxing. And I have to tell you, my kids love that. They love the interaction with other patients, hearing the other experiences of the other patients, going to the temple over there and having that serenity, and also just walking with me, and it's a bonding time with me. So I wanted to mention these things because some people might expect, okay, I can bring my laptop, I can do work while I'm over there. Please try not to do that. And also they told me no chocolates, no sweets, and so on. So there is going to be adjustments, okay? But that is based on our experience. The other thing I wanted to mention is that I have seen a lot of little kids in there being treated for a variety of conditions. So I've seen little kids less than 5 years old. Okay. Now I wanted to ask if there are other questions. So I will continue with my questions. Um, Going back to the research that's going on in Sreedhareeyam, um, because I myself, I am a statistician, so I like to take a look at data and I track the progress of my son. I track the audiometry information, and just also the numbers of his eyes. I'm still trying to understand what's the different numbers involved in the different tests so that I can analyze it. But the fact that every time we went to Sreedhareeyam, they did diagnostic tests. I think there were at least 4 diagnostic tests. It tells me that data is being collected, and data and that sort of tracking of the health of the eyes, and I will be there. So I am very confident that Sreedhareeyam is going to come up with this comparative study across more than just one patient, but right now they're trying to do 50 patients. So if there's anything that the Usher Syndrome Coalition can do to help with this research, please let us know, because we're really very much interested in seeing what is the effectiveness of Ayurvedic treatment. Um, the other thing I okay, the other thing I
Sure.
wanted to go ahead.
No, sure. We are also very happy uh, to be with you now for that. This is we are trying for that. Thank you for your that.
All right. Um, the other thing I also noticed that there are other conditions that can also lead to the deterioration of vision. And some of these conditions, such as cataract, myopia, dry eyes, retinal detachment, I have heard other patients with Usher syndrome report this, especially the cataract. I've met patients in Sreedhareeyam who have had these conditions, not RP, but blindness due to diabetes, and they are being treated there. So um, I actually wonder if there is also studies being done for these other conditions, like for cataract or retinal detachment, if there are also studies being done right now to see if the Ayurvedic treatment is helping with these conditions.
Yes, yes, yes. We are doing that in diabetic retinopathy and all. We are doing studies, and in that there is improvement in that condition retinal conditions, and that usually that patients used to, because in retinal edema and all, they used to have injections, intravitreal injections and all. But after that, because with Ayurvedic treatments and some therapies, sometimes internal medicines and some external therapies also, that can help to reduce that swelling, edema, swelling, and they can reduce the number of injections, or at least to stop the injections. They are helping. But the thing is that they should have some means of life, because their healthy lifestyle that should maintain the diabetes and all. So like that, some diabetes treat along for that, the diabetes treatment also will be providing that for. But they have to maintain that condition. If they maintain their health lifestyle, that this can that retinal health and vision loss will be arrested. That way that we are doing that and getting good results also in cataract and all early stages, early cataract we are treating, we are giving medicines to mean, so that can help to prolong that this surgery and all. In mature conditions, we also advise surgery for them. If no other complication is there, if any other nerve issues are not there, then we advise surgery only. We are sending them for surgery only. And but in degenerative conditions like RP or Usher's and all, that surgery anyway maximum will prolong, that maximum will prolong. If they cataract that much affecting their vision, then only we'll advise them to for surgery. Other conditions and detachment also, in early detachment, if it's not in a surgical condition, then we'll treat. Otherwise if it's a surgical case, then we send them for surgery only. Myopia and also that good results for reducing that power. And also then some are having without glasses, means for avoiding that glasses also will help for that, the treatments will help.
Thank you, doctor. Um, any other questions? Okay, so no new questions in the chat, so I will continue with my question. Um, so some of our members here, they require interpreters because they are deaf with very low vision, and some members are completely blind. So the question is, will the interpreters be allowed in the treatment room so that they can help the patient, understand whatever instructions are given by whoever is giving the treatment? Or maybe there's another way of doing it. I don't know.
Mm, usually because most of them will be if they are deaf and blind, then somebody will be there with them, no? Some usually they will come with that some bystander, and if they are from outside, then we advise them to be with some bystander, because otherwise sometimes, because that the staff, the treatment staff, everything, because all of them can communicate with everyone in that way. So like that, but if it's necessary, we'll do like that also, we'll provide like that, we will think of that also.
You mean you'll think about the providing a,
Interpreter,
yeah, or
interpreter also, yeah, we will think
oh,
about that, because usually the most of them will be with deaf and blind, then they will be, somebody will be there. But otherwise also, because some cases with very low vision, they are staying in that ward, so others also will help with them, others also usually help with them, because and staff also will help for that, for the treatments, they will help, no problem. Only for their own work, no, their own other normal work, only they need some help. But other, usually they can stay if some vision it's there, but it's completely blind anyways, and it's, somebody should be there, but we'll think about that if it's needed.
all right. Thank you, doctor. I have a question about cochlear implants. I do not have experience with cochlear implants, but if there are oil treatments around the ear, I don't know how that can be done with the cochlear implants, or is it okay? I Those who have cochlear implants in the audience,
But because if cochlear implant it fits there, then therapies will change accordingly, without obstructing that. Okay.
all right, all right. Okay, I'm glad to hear that. Um, Now, any other questions from the audience? If if none, any parting comments from Dr. Sreekala?
No, only thing that because this is not anybody's fault or like the, because born with the problem, born with the hereditary complaints. So whatever that, we have to accept that condition, and others should help for that acceptance also, and surroundings, because you are all doing a very good thing, because this coalition also, because many, I think I have gone through that, some activities that activities go with the OSHA's syndrome. But whatever possible things, because it's a, if it's not curable also, because if we can maintain that condition, and if other systems are also helping for that, you should accept that, and you should take the benefit from that. And because we have to fight with that, and just to improve our life, no?
That is true, doctor. For for my son, I want to be able to maintain the health of his eyes and ears while I wait for the results of other research, for example, gene therapy and others. So if his eyesight can be maintained, of course, with the guidance of us parents, because simply doing the treatment without a change in lifestyle or diet is not going to help. There
Mm.
has to be something from us, from the patient himself, to say, I want to maintain my eyesight. I should not be whatever playing in the computer for so long, or
Uh,
being out in the sun so much, and so on. The other thing is that I believe we also have to um, be aware of other conditions that can further deteriorate our vision, such as diabetes. We might think that the deterioration, a sudden drop in vision might be because of Usher syndrome or retinitis pigmentosa, but it could also be due to something else. That is also possible. So we just have to be very observant as parents, be very observant as individuals, and I guess just try our best to maintain a lifestyle. And I know not everybody is going to believe in Ayurveda, uh, but for those who do believe in it and have seen how it can work, hopefully this webinar has been helpful for you. I am going to post in the group the contact information for Sreedhareeyam. I will also post this video after I edit the captions. I'll post it in YouTube along with some contact information. So beyond that, I would like to thank our guest, Dr. Sreekala. Thank you so much. Hopefully, I can meet you the next year. I'll take my son over there. And believe me, I would like to help with any kind of research in any capacity that I can. Thank you.
Thank you. Sure, we will meet. And we are also very happy to help you any kind of help from our side. If you want, then you can, sure, without any delay, we can help you at any time, no problem.
All right.
Thank you for giving me this opportunity for meeting all of you.
Okay. Thank you so much. Thank you. All right. I'm going to end the meeting soon. Um, Let me stop the recording.